Having me. I'm really excited to be here. My name is Karianne Gwynn Johansson. Gwynn is what you would find in my medical record because I have had bigger fish to fry in the last year than changing my name. I love you. I'm a Johansson in my heart. I'm excited to be here. I am in school to be a nutritional therapy practitioner. And this is a community outreach project for me. And so when that assignment was announced, I was like, I totally know what I want to do. And so I emailed Dr. Xavier and asked her, and just so honored to get to be here with you. So I would love to hear a little bit from you, what your name is, what you want me to call you, if you want to go by doctor, your name, or not. And then also just a tiny bit about why you chose to be in this field. Who wants to start?
I'm Erin. A little bit about us. I come from Oregon. I'm loving San Diego. I'm clear where I'm going to spend the rest of my life, but
Are we all?
I guess I was drawn to oncology in the first weeks of medical school because I'd done molecular biology in college and learned all about the biology of the cell. Absolutely loved it.
Mm-hmm.
And then as we were learning through the different diseases, I think cancer is the most respectable disease there is. It's very interesting how it manipulates our cell biology. But the reason I liked it from the very beginning of med school is I worked with a surgical oncologist, and he would walk into the room, hug every patient. They all called each other by their first names.
Wow.
They had amazing relationships, and it just made me realize that when you get diagnosed with cancer, it opens up this door to have this amazing relationship with patients.
Yeah, that's awesome.
Yeah.
Thank you.
I'm Emily, but yesterday was called Sugar Doctor, so I don't know why. From Detroit, and I actually got in this field because I really loved hematology, and I came to med school to be a pathologist, and then I decided to see people.
See people and not just blood. That's
Exactly.
Awesome. Thanks, Emily.
That's pretty much summarizes it.
I'm Stacy. I'm one of the first year fellows. I'm from Sacramento. Kind of like Erin, I was drawn to hemoing very early in med school, and the patients are sick and medically complex, and I think that's the most interesting patient population.
Yeah, great. Thanks, Stacy.
I'm Andrew. One of the first years. I'm from San Diego and I never left Southern California.
All right.
I think kind of drew oncology the same way Erin was. I was actually doing my OB rotation, and I hated everything about it except like the gynecology part.
Smelly babies.
Awesome. Thanks.
I'm Vera, one of the third year fellows. I'm from Bakersfield. I've been here for a few years. And I'm not sure. I just really like oncology. I like the relationships you develop with patients.
Yeah.
I think it's a totally different area of medicine. It's kind of its own universe and the people you work with. So I just really enjoy it. I'm kind of interested in like prostate cancer and bladder cancer and stuff like that. So so many of our, basically 90% of the patients will ask you, what can I do? And a lot of times it's about nutrition.
Yeah.
And I think that there's a huge hole in what we tell patients. And I think that there's a huge opportunity, not just for referring to you guys, but kind of giving people some tools to take some of the control back in their disease, because a lot of things that we're telling them is what we can do.
Right.
But I think patients really just want to feel involved and that they can do something. And even though it may not change, survival curves or things that we're used to thinking about, obviously there's other endpoints in how patients are managing through their illness. So I'm interested to see what you kind of can help us with.
Great. Thank you, Vera. So we're just getting a little introduction.
Sorry.
That's okay. Good morning.
Good morning.
If you just want to tell, everyone else probably already knows your name, but just tell me what your name is and kind of why you got into the field of hematology and oncology.
Oh, okay. So my name is Mei Ling. I'm one of the third year fellows, and I went into hematology and oncology mainly for the patients, because I think that we have a unique opportunity to develop long-term relationships with patients from diagnosis until the end, and it's a really special bond that we share with them. So I feel like we're able to make a big impact on their lives.
Yes. Yeah, thanks, Mailing.
All right, I'm Nicole. Grew up in Northern California and took a long detour on the East Coast before coming back. And I got into oncology essentially the same reasons. My mom was diagnosed with breast cancer when I was in high school, and her relationship with her oncologist and the way he advocated for her care really made a difference in her life.
Yeah.
So.
Yeah, that's awesome. Thank you. Well, my name's Karianne, and you can probably guess why I'm here. I had never had an interest in cancer until I was diagnosed with it, and I'll talk a little bit about that. But through my journey with chemo and treatment and dietary changes and all of that, it just became very apparent to me exactly like what you were talking about, that kind of in this pie chart of cancer treatment, standard care only accounts for a certain portion of that. And my realization was, well, what about the rest of that pie chart? Like, there must be something that I can do about that. And in talking with Dr. Xavier and I have a stupid amount of friends that have cancer, not even that I knew before I was diagnosed, so it's a strange thing. But in talking with them, it just became so apparent that there is this huge knowledge gap, and you are scared as a patient and you don't know what to do and really need guidance to take control of that piece that is in your control, and I think it's really empowering. So I'm really excited to finish my Nutritional Therapy Practitioner program in June and get to work with oncology patients during treatment. But especially afterwards, I'm learning in the aftermath of going through 576 hours of chemo that my body needs a lot of support. And a lot of people are not finding that support. So I'm excited to get to be a person that kind of advocates for them as well. And just is able to really say, I have been in your shoes. Like, that's something that is such a powerful thing that makes me want to cry every time I talk about it. But I am just so privileged to get to be here with you and know that you all have amazing knowledge that you have shared with me, many of you that I've met while I was in the hospital. A little bit of kind of backstory about me. I'm from San Diego. I'm like not going to jump straight into my personal health issues. But I am from San Diego, and I was, healthy for the majority of my life. Had some GI issues for a long time, and I went to school in Seattle. Oh, I also went to school in Ecuador, which is where I picked up a really fun parasite. And I like to name sicknesses because I think it kind of helps, like, this is not necessarily my enemy. It's just like a boyfriend that I need to break up with and be like, this is not serving me anymore. So I named my parasite Brutus Rex Shiitake, first, middle, last name. And so I had a lot of things going on for a long time. I was dealing with chronic fatigue and just pain all over my body. And remember talking to my parents and just saying, like, I do not understand what is wrong with me. Like, I should feel healthy, I exercise, I eat well, and I don't. Like, I was 24 at the time, and I was like, I feel like I'm 50 years old, like I'm in pain every day, and had all kinds of other things, sympathetic dominance, really low blood pressure, low cholesterol, low vitamin D, depression and anxiety, and then Brutus was kind of the really fun kicker. So that's kind of my backstory. And then a year ago, a little over a year ago, so December 2016, I woke up with a very large lump on my neck, and I had some really bad generalized muscle and nerve pain on my right side for a couple months, and had just thought, I have knots in my shoulder. I was just so uncomfortable, like that gnawing pain that you cannot get to go away. That's like kind of crazy making. And I had that kind of thing going on, and in the couple months prior, I had totally lost my appetite. Mike, this is my husband Mike, by the way.
Oh,
He's
hey.
wonderful.
Hello.
We got married in March, and a few months later is when I started feeling pretty nauseous and losing my appetite, and I just could not stand to eat vegetables, which was very weird for me because I was a really healthy eater, and I thought I was pregnant, which was going to be the worst thing because Mike was in grad school. I was like the primary breadwinner. I was like, I could not be pregnant. And I just had an aversion to all these foods that I used to love. And I'm looking back now, I understand what was going on because really the only foods that I could tolerate to eat were toast with peanut butter or candy, like straight up candy. And I'll share a little bit more about that, but that was a really interesting connection to start to understand, oh, how do cancer cells work and what fuels them? So I woke up with this lump on my neck, got several inconclusive tests done, and when the needle biopsy surgeon said we weren't able to test the cells because most of them were necrotic, I'm like, what does necrotic mean? And when she told me, I was like, that is not a good thing. And that was kind of the moment that I knew, like, this is going to be cancer, and was officially diagnosed with some form of lymphoma at the beginning of December of 2016, and had to wait for a couple weeks while our lovely smart folks at Stanford figured out what kind of lymphoma it was, which is gray zone lymphoma, which you likely have read about my case because I'm so fun and special. But it was a really interesting journey learning about that because I had done all this research on different kinds of lymphoma and, diffuse large B cell and Hodgkin's and different kinds of non-Hodgkin's. And so when I saw my test results, which the surgeon gave me actually without explanation, she wasn't even there, I just picked them up at her office. Don't ever do that, it's such a bad idea. I was reading this and I emailed her and I said, if I'm understanding this correctly, it looks like I have Hodgkin's and non-Hodgkin's. And she was like, yeah, it's going to be really complicated. And I said, well, who are the specialists with this? And she said, you're not going to find any specialists, which is not a very positive thing to hear. So me being the Enneagram 8 that I am, if you know what the Enneagram is, the 8 personality type is the challenger. It's like, I'm going to take hold of this and grab the bull by the horns and just make it happen and do whatever I can. Started researching gray zone lymphoma and dietary things. And quickly, Mike and I left our apartment in San Jose, moved down here to see Dr. Xavier and to live with my parents, who I love, but it's definitely not what we imagined in our first year of marriage. So that has been a fun adventure. But I saw Dr. Xavier and she said, if I were you, I would not wait for any more than 3 weeks to start chemo. And so it was kind of like we hit the ground running really quickly. And in preparation for chemo, I had read blogs about what I wish I would have known before chemo, and people said, get your dental work done because your gums are going to be really sore, and cut your hair short before it falls out so it eases the transition and stuff like that, and about doing things like crafts through chemo. So I had this whole Pinterest board that was crafting through chemo, and I was going to get into weaving and looms and embroidery, and I never touched any of the stuff that I bought because I got obsessed with research. I could not stop researching. All of my free time, I was researching everything. And I also named cancer Lawrence. So my primary mass was right above my right collarbone, and Lawrence is a very sophisticated name. You don't meet a lot of people named Lawrence. But you might meet a Larry, but Lawrence is kind of fancy. So then it became the death of Lawrence was my hashtag. This is a photo of me after round 2 coming out of the hospital, and my mentality was kind of I'm going to take control of what I can take control of, and I'm going to kick some ass because I'm way too young to be taken down by a rare cancer that has, frankly, not very good survival rates. So that's when all the research came in. And I became pretty obsessed with trying to understand every single thing that was going on. What is happening with my cells? What are they doing? How do I protect them? I watched a documentary that really freaked me out about organ damage, which is, as you know, a very real threat. And I called a naturopath that I used to see in Seattle, and I was like, Dr. Matt, I'm losing my marbles. I start round 2 tomorrow. What am I supposed to do? I don't want to have liver and kidney damage. And I know a woman who had a heart transplant because she literally said chemo killed my heart. And that kind of stuff is not what you want to hear when you're 28. So I went bananas researching things. And one of the things that I first got most hooked on was this idea of what a PET scan is. Because this whole, like, they have the signs, you're radioactive and don't be around pregnant women, and waiting in the waiting room, I couldn't help but sing that song, like, whoa, whoa, oh. And I was like, what is going on? What's in my body right now? And why does this show where cancer cells are? And so I think that the most fascinating thing is that they have you do no sugar, no fruit. The places that are really anal retentive say no grains beforehand. They don't all say that, but and water only fasting for 6 hours prior, and then the cancer cells light up like crazy on this scan. And so that caused me to think, well, why? Why do the cancer cells light up and regular cells don't? So every time I got a PET scan, I was always asking the techs, like, how do you explain what's going on in the body right now? And they said, you know, this radioactive glucose isotope, it's like a fake sugar, your cancer cells love that, it activates them. And so I thought, well, then it seems like the first line of defense for cancer patients should be, we have to stop eating sugar. Like, if that's waking up cancer cells and feeding them, that's gotta be the first thing that we cut out. And so that kind of got me researching all kinds of stuff between the difference of cancer cells and regular cells, which brought me to metabolic flexibility. So this idea that our healthy cells have the ability to adapt to different environments. So if you think about kind of our ancestors, they were not always in a state of feasting. There was famine, and yet they still survived. So if the body was not using nutrients as it came in, it must be using nutrients that are already stored in the body. Whereas cancer cells don't have that flexibility, and they do, of course, have more than one fuel source, but it's very obvious via research and PET scans in general that their primary preferred fuel source is glucose. So that's one of their only options, is to use sugar. And so healthy cells, though, can use other things, like they could use glucose, which is obviously the most easy to use, fatty acids, ketone bodies, which the body starts to produce in periods of fasting, so that when we did have famine in the past, the body has this new fuel source that fuels the brain and organs and all kinds of things. Moral of the story, cancer cells are dumb for a lot of reasons. The primary being that when they are in a state of hunger, they are not creative problem solvers. They don't think, okay, well, the glucose is gone, so I'm actually going to switch my fuel source to fatty acids or ketone bodies. They just panic. They're like, oh my gosh, I'm starving, what do I do? Whereas healthy cells are like, okay, this is not the first time that I have seen this famine phenomenon. I'm gonna make it happen and mix things up and find a new fuel source. So short-term starvation, which I know the word starvation sounds like a scary, dark word, became something that I looked into a lot because I kept finding this stuff about how our cells work and how the short-term starvation weakens cancer cells. So that became kind of my exciting thing to look at. And Mike wanted me to make sure that I said this really funny line. And I gotta see if I remember it correctly. So